I'm Chief of the Cancer Control Section at the Minnesota Department of Health. Among other things, I oversee a program called SAGE, which is a statewide program that provides free breast and cervical cancer screening for low-income, underinsured women. We've screened almost 120,000 women in Minnesota. We're now screening 18,500 women a year. We found over 1,400 cases of cancer. The first point that I'd like to raise is that it's rather amazing to me that we've become inured to the statistics around the number of women who are dying, the number of people who are dying, the number of women who are dying from cancers unnecessarily. In Minnesota alone, there's about 600 breast cancer deaths, 350 colorectal cancer deaths, 50 cervical cancer deaths. All of the cervical cancer deaths, probably 2/3 of the colorectal cancer deaths, and 30 to 60% of the breast cancer deaths are preventable. For breast and cervical, for cervical and colorectal cancer, you can actually prevent cancer from occurring by detecting precancerous conditions and treatment. And applying conservative estimates, 460 women in Minnesota every year are dying unnecessarily. And I find that I work at the Department of Health, and we're always dealing with budget cuts, federal cuts and state cuts. And it's amazing that if you put it in another context, if you said 3 757s are going to crash at MSP every year, how much would we pay to prevent that? In Minnesota alone, there's no amount of money that would be too much to prevent that kind of catastrophe. Yet we're sort of numb to the idea that almost 500 women are dying from something which is completely preventable. It's just a lack of prioritizing and a lack of resources. We have the technology, and it's been shown to work. So one thing I suggest is a reprioritization within healthcare around prevention, but particularly, and the thing that I'll advocate for is around early detection of cancer.
30 seconds.
Secondly, co-payments and deductibles inhibit use of healthcare services. This New England Journal of Medicine just had an article out. Our program shows that to be the case. Small co-payments to one person is a large out-of-pocket expense to another, and people don't get screened as a result. Third point is that healthcare.
The health bill will make there'll be no copay for preventive procedure. Go. Sorry.
It's your day. If health and health services are made available, it doesn't ensure that people will use them. And so social marketing, which is effective, has to be done in order to get services not overutilized, but shouldn't be and appropriately utilized for those like
and we'll be funding
screening.
public health and public health information.
But it's not done well right now, and the CDC is not off the record. The CDC does not do a good job, and it's not innovative, and there are strategies out there that work. And the last point that I'll make is if healthcare reform is stalled, one of the most egregious things is that the uninsured pay 3 to 4 times as much for the identical services as the insured. So if we reimburse for mammograms, but I see EOBs around this stuff. I know 3 of our largest providers charge women $350 for a mammogram, but Medicare reimburses at $125. And it's, talk about regressive. So I'll
Thank you.
Thanks.
Senator, thank you so much for having the forum and allowing me to participate. Bonnie, thank you for hosting it. I'm Christine Norton. I'm a retired high school teacher and co-founder of the Minnesota Breast Cancer Coalition. I'm a field coordinator and on the board of the National Breast Cancer Coalition. And I'll provide my complete comments to Lauren and to you, so I can stay in my time.
Without objection, so.
I've timed enough speeches in my career. The National Breast Cancer Coalition developed a framework for healthcare reform, and we measure each of the pieces of legislation up against our framework. And of course, we've done that with the Tri-Committee bill and with the Health Committee bill. And there are 3 things that I'd like to focus on: evidence-based medicine, comparative effectiveness research, and consumer representation. Evidence-based medicine is something that the National Breast Cancer Coalition believes firmly in, And while the Health Committee bill does create a Center for Health Outcomes Research and Evaluation, it doesn't specify that the payment is based on following evidence-based research. And thus the bill seems to walk a fine line between supporting the research and supporting the dissemination of the research, but not allowing the evidence-based research to be the determinant of benefits that are required in the essential benefits package. We believe that healthcare providers should be paid for treatment that is based on evidence and not paid for treatment that is not based on evidence. We think this would be a big cost saving, and it would also be providing better health care for everyone in the country. We also believe in comparative effectiveness and using that research to enhance the delivery of efficient, effective, and high-quality care that would provide benefits to all patients and would help us to do away with 30 seconds with a lot of the overtreatment that we have. It's okay. Third aspect of reform, you're going to get the whole ball of wax. Third aspect of reform is consumer representation in all boards, commissions, and committees, and we would like to see that at 25%. We believe it's crucial. And in my remaining few seconds, I'd like to say that a lot of the obstructionists against healthcare reform remind me a lot of my former students who, some of my former students, who would say, you know, Ms. Norton, I really want to pass your class, but I really can't do the homework. Reading stories, novels, poems, that's not my thing. Can't come in for extra help. Really, you know, I can't make it here 5 days a week, but I want to pass your class. And so to me, the obstructionists say, we want healthcare reform, but you can't do this, this, and this. And Senator, we elected you to do the right thing and the moral thing. And I think that everyone around this table believes that systemic healthcare reform, not around the fringes, is what we need. Thank you.
Well, let me just say that evidence-based medicine, very effectiveness, you're singing from the same hymnal.
Right.
And you're singing from the same hymnal as Mayo. And I've seen Mayo beginning finally, for the first time, I think, in their existence, to come be part of a debate like this. And I think that bodes very well. But you're right. We've got to change the way we deliver care and the way we pay for it and what we incentivize. We have to incentivize